So, Carrie, how did you decide to become an art therapist?
Um, well, I've always been really interested in art since I was young and had my own struggles with anxiety and depression starting as a teenager. Um, and I had a great art teacher that really supported me and helped me through those times to express myself through art because I really had trouble verbalizing my feelings. Um, so then, I went to art school and got my degree in fine art. And I was a photographer for a little while. I was a preschool teacher. And then I realized, I think I really love working with people. I love art. I think I can combine these two things. And I had heard of art therapy. Actually, the school that I went to undergrad, Pratt Institute, had a master's program in art therapy. So went back to school and after that, once I got my degree, I got in working at a hospital, running art therapy groups. Um, so I started working with all ages. I started off with children, um, but then I got into working with adults in the hospital setting. Really loved that too because adults are basically big kids. so um, so yeah, and the rest is history.
All right. Uh, The internet suggests that art therapy is an effective approach for managing some forms of stress, anxiety, grief, substance use, and other conditions. In your practice, what condition or situation most typically leads new teenage and adult patients to your art therapy?
Good question. So there's a lot of different things, but mainly it is usually big life changes or life stressors that bring people in. Um, Anything from grief and loss to sometimes it's just developmental changes with kids, like they're just struggling as they're developing from one stage to another, or they're struggling in school. With adults, it's oftentimes, issues with relationships or, losing a loved one. It could be, especially with COVID, there was a lot of big changes there that brought people in. Um, so, yeah, mainly needing support during stressful times in life. And, I think that's really natural.
Hmm.
So I think we all need help during those times.
So you've answered this in a way just briefly, but I understand that many forms of artistic work might qualify as therapy when applied with an understanding of anxiety management. But what training prepared you for your work in the field of your art therapy? You mentioned the school you went to.
Hmm. Yeah, so the a lot of people don't realize just like how involved art therapy training is. It's not just knowing, how to use art materials. It is a lot of psychology. I had to study a lot of psychology courses before I could be admitted into the art therapy program. Once there, we were studying a lot of different theories of psychology. We were also doing a lot of um, experiential learning, which is basically doing the therapy yourself in the class, or what it would be like. And we also ran an art summer camp for kids. So learning through that, um, so I have a lot of experience in counseling and psychology. I have to know the DSM-5. I have to know, how to diagnose. I have to know the proper treatments for different diagnoses, as well as, all the creative stuff. So knowing, how art materials work, how art materials bring up certain emotions for people. There's kind of a spectrum of art materials. So the more fluid the art material, the more emotions it can bring up for people. So,
Carrie, I'm particularly interested in sand tray therapy, which we talked about briefly when I visited your studio. Would you comment
Mhm.
on this approach? Is it appropriate for groups as well as individuals?
so I have mainly done that sand tray therapy just with individuals, just because logistically, you know, you need, if you're running a group, you need several sand trays, and that can be expensive. So uh and you also, I think it only works with a certain population in a group setting. You need people who are somewhat in control of their emotions. um I think that people don't realize that these kind of creative experiences with sand tray, you're basically, creating your own world in the tray. And subconsciously, you could bring forth um, repressed emotions, repressed memories. Um, so people think, oh, it's just playing, but it can be intense for people. They don't realize it's almost like, if you wake up from having an intense dream, it can be like that sometimes. Your subconscious just leads you to express something in that tray. So personally, I find that it's easier to do one-on-one, um, to, I think it's really important for me to be able to observe what's happening with that person, which would be a little bit harder in a group. And but I've also done sand tray therapy on my own personally. So I think there are ways that you can do it on your own if you are self-aware and you're in control of your emotions.
Okay. Um, I know it's difficult to generalize, but how rapidly might art therapy begin to produce noticeable relief from anxiety? How frequently might a patient expect to return for continued care?
So it's different for every person. It really depends on, how long that they've had symptoms, or, or struggle, how long they've been struggling with the issue. A lot of times with just life changes, that you tend to see more fast results, because as opposed to, say that it's something that they've been dealing with, like trauma since childhood, that kind of thing is going to take a lot more in-depth work, and it will take time to see results. Whereas if someone, you know, lost their job, but they were feeling fine before that, just helping them through that change might see quicker results. That being said, I think that I oftentimes see my clients find relief just in one session. As far as how long that relief lasts, that's, sometimes it just lasts for the time that they're here, and then they go back out into the real world and their stress returns. But I think it's important to show people that just a little bit of time to express your emotions and, find some distraction or peace through the art making process um, is really helpful because they start to realize, like, okay, this insurmountable problem is actually not as insurmountable if just doing some relaxing activities can help with this, you
Okay.
know?
So a final question really is I would call it the money question. Is art therapy an insurance covered practice? And if patients are uninsured, what advice might you offer?
hmm Yeah, that's a great question. Um, so for me, I have my license in mental health counseling. So in the state of Rhode Island, with my license in mental health counseling, I can bill for insurance. But there are art therapists out there that do not have their license in mental health counseling. Um, so in the state of Rhode Island, unfortunately, um, an art therapist on its own cannot bill insurance. In the state of New York, you can. In certain states, you can. But in the state of Rhode Island, we're still a little bit behind, and you need that other license in order to bill for insurance.
Okay.
So if someone is not insured, what I would recommend is, you know, there are, ways to get state covered insurance. So I would suggest them to look into that through Health Source Rhode Island. Um, but also what I do is I've had clients who, lose insurance and have periods of time where they don't have insurance. And I'm more than willing to work with them, offering a sliding scale fee. And so that's something that people don't really realize is, you can ask counselors, I'm really struggling, I'm planning on getting insurance. In this time that I don't have insurance, do you offer a sliding scale fee? Is there something that we could work out? And people don't always realize that there are counselors and therapists out there that are, willing to work with you on that.
Okay. Well, thank you, Carrie. I really appreciated this brief introduction, and I'm hoping that we'll have a chance to have you visit us when we get our group together at Blue Skies in the near future. Thank you so much.
Great. You're welcome.